Do we have
You're
to?
gonna do this?
Shh.
Don't be yourself.
Hi, I'm Jill Bugato, and this is my 3D speech. That was my audience. So first, I would like to thank you guys all for coming to learn a little bit about what to do in the event of a cardiac arrest emergency. So, how many of you guys have ever been faced with somebody who's had an emergency like a cardiac arrest? And were you scared?
Totally.
Totally scared, right? So here's some statistics to kind of give you the idea of why it's so important to know about how to respond to a cardiac emergency. The cardiac arrests is the leading cause of death among adults over the age of 40. So if you look at this graph here, this is the sudden cardiac arrests, and it's just as many as all of these other causes over here. So almost 400,000 sudden cardiac arrests occur every year. And the sad part is that actually if they are given aid, they would have a much better chance of survival than if they are not given. So today we're going to go over how to handle a cardiac arrest emergency, what is the difference between a heart attack and cardiac arrest, also the signs of a cardiac arrest, some basic steps you can take, how to administer CPR, and then finally ways that you can be prepared if you are ever faced with this emergency. So a lot of people think heart attacks and cardiac arrests are the same thing, but they're actually different. So a heart attack is when the blood is blocked and it's not flowing through the body, and you're usually going to get some kind of symptoms like, you know, the tingling of the arm, you're going to feel pain in your chest, and you're going to be able to get help for this. A cardiac arrest is sudden. Your heart stops beating, so your blood is not being pumped through your vital organs, and it can affect people with no history of heart disease. So it's a very sudden emergency. And then if people do not get immediate help, they can die from it within minutes if they don't get CPR. So some of the basic steps that you want to do is that, or the signs rather, of cardiac arrest is that all of a sudden somebody will lose consciousness, they'll be unresponsive. If you try and tap their shoulder, you talk to them, they're not going to answer you, and they're also not going to breathe properly. So if you tilt their head back and they don't take a normal breath, that is when you would want to go ahead and start doing the basic steps of first aid for this person. Now the very first step, don't be like this guy. Don't panic, don't freak out. You want to remain calm so that you can properly assess the situation and give this person help. Next thing you want to do is you want to call 911. You want emergency responders to be on their way to help you. And then finally you're going to start administering CPR, which is also, or short for cardiopulmonary resuscitation. So why is it so important to learn how to do first aid? Now, CPR, if given immediately when somebody suffers cardiac arrest, can double or even triple the chances of somebody's survival. But according to the American Heart Association, 70% of people feel helpless if they are faced in this situation. And as a result of that, 32% of people will get CPR. Only 32%. And then less than 8% of people who have a cardiac arrest outside of the hospital will actually survive because of this. What makes it really scary is that the 88% of cardiac arrests, they're actually going to happen at home, which means that the life you save is probably going to be the life of somebody that you love, you know, your husband, your father, even young children it can happen to. So the American Heart Association has done away with the mouth-to-mouth resuscitation. A lot of people don't know that. It used to be the chest compressions followed by the mouth-to-mouth. So now it's only going to be chest compressions. And there's two ways to do that. One, pick up the phone, you're going to call 911, and then you're going to start administering CPR. So you're going to take your hands, you're going to interlace your fingers. In the center of the chest, you're going to push hard and fast. Very good. I can see you guys all doing it. Now, how hard and how fast should you do it? It's actually pretty easy. All you have to do is administer it to the soundtrack to Staying Alive. You all know that, right? I'm staying alive, staying alive. That right there is 100 beats a minute. So that's how you do it. I know, you guys are going to have that like stuck in your head for the rest of the day. I apologize, I'm sorry. But that's basically how you do it. Exactly. So there you go, that's how you're going to do CPR. If you want to be more confident in your ability to help somebody, they do recommend taking classes and getting certified. The American Red Cross does offer first aid CPR classes, which they will be teaching coming up here at the University of Hawaii at Hilo. There's one October 12th, there's one November 2nd, December 4th. You can sign up for one of those classes. If you can't make it there in person, you can also go to redcross.org, and they have online classes that you can take as well, just to make sure that you are prepared in the event that something happens, such as you witness a cardiac arrest. So today, we talked a little bit about the differences between a heart attack and cardiac arrest, also basic steps to take, how to perform CPR, and then of course get enrolled in one of these classes here that are available at the university or through the Red Org. So thank you guys all for coming, and I appreciate you listening to my speech. Hopefully you guys will walk away with some important information and can possibly save the life of somebody you love. Thank you.
Stage alive.